All right, so today we're talking about posture and breathing for your pelvic floor, okay? So this is your spine, all right? This is looking at your spine straight on. So just like I'm facing you right now is how this spine is situated, okay? If I turn to the side, the spine sits like this, okay? So during pregnancy, baby sits right here, okay? And what tends to happen when baby sits right here, if we turn to the side, is this pelvic bone tends to kind of tip forward as that weight drags the stomach forward. So when that happens, we tend to turn our posture into something that looks normal, into something that looks like this, right? And the butt kind of sticks out and the hips jut back as the belly protrudes forward. So when you're in that kind of a slumped posture and you let your hips stick back, what happens is you're turning off the pelvic floor. So what I want you to start doing is just paying attention to your posture and paying attention to if your hips are far back or if your shoulder blades are starting to sit a little bit forward, because having that forward lean is just like a hose, right? It's like you're kinking the musculature of the core and then therefore shutting off the pelvic floor. So posture is something I really want you to notice while you're just going through your week, okay? Now, the next thing we're going to talk about is breathing for your pelvic floor, okay? So again, baby sits here. Your diaphragm, which is a dome-shaped muscle right above your abdominal cavity and below your lungs, sits about here, okay? So if this spine is in me, baby sits right here, diaphragm is about here, okay? That diaphragm, when you inhale, comes down. Okay, so you inhale, diaphragm comes down to let the lungs really fill up with air. And then when you exhale, the diaphragm comes up. Now, you can imagine during pregnancy, especially as baby gets bigger, okay? When baby gets bigger, we don't have as much room for the diaphragm to move down, okay? So baby gets bigger and the diaphragm, maybe if it expanded this much normally, with the baby in the way, it maybe only gets this much expansion, right? So we're gonna put the spine down and we're gonna talk about a little breathing exercise so that way you can make sure you're getting air and that expansion of the lungs all the way down to put pressure into the pelvic floor, okay? So what you're gonna do is you're gonna put one hand right on your lower abdomen, okay? The other hand is gonna go on your side of your rib cage. And you can do this lying down if your OB mentioned that it's safe for you to be lying on your back at this stage of your pregnancy. Go ahead and lie on your back. That's definitely going to be the easiest way to do it. You can sit kind of crisscross applesauce on the floor, and that might be another easy way to do it with your back up against the wall. And I can show you some of those variations, but I'm going to show you standing first, okay? So if you're standing, you're going to put one hand on the lower abdomen and one hand on the rib cage. You're going to take a big breath in. And when you breathe, you want to make sure this hand moves and that this hand moves. Okay, so breathe in. Good. So you're going to notice you're also going to see some movement in my chest here, some movement in my shoulders, and that's all okay. But I want to make sure you're also forcing air way down into the abdomen. So force that diaphragm to really expand and put pressure down, and really force that hand on the side to open up, okay? So big breath. Good. So I want you to practice that this week. Take your deep breaths 3 times a day. I like to have my patients do their deep breathing first thing in the morning. As soon as they get out of bed, they have their morning routine. They go through their yoga, their stretching, their water, whatever they do in the morning, and then take 5 big, deep belly and side breaths, okay? As many times a day as you feel like you need to, go ahead and do that. I typically like to recommend 1 break in the middle of the day for those big, deep belly breaths, and then again before you go to bed at night. So 5 breaths 3 times a day at minimum, or you can do it more often. Okay, so we're watching again to recap the video. This week we're paying attention to watching our posture, so making sure our hips aren't sitting too far backwards or our shoulder blades aren't forwards, okay? Because we want to maintain a nice neutral spine throughout the pregnancy to keep the spine in neutral and keep the pelvic floor active. The second thing we're gonna do this week is incorporate 5 deep breaths 3 times a day with one hand on the abdomen, lower abdomen, one hand on the rib cage. And when you breathe, both hands should move, okay? If that is difficult for you, that breathing exercise, please send me a message, email me, text me, call me. We'll set up a FaceTime and we will walk through it together. All right, thank you guys so much. Enjoy.